Hi, I'm Sarah Borders with Benefits Compliance Solutions. Recently, CMS issued a fact sheet that basically said that plans, when determining if their coverage is credible for Part D coverage, they could in fact use the simplified determination to make sure that their coverage is in fact credible or non-creditable with the Part D standards. So if you'll remember, all group health plans are required to disclose to their participants whether or not the coverage that they offer is creditable or pays as good as or better than Part D coverage under Medicare. So individuals need this information to be able to decide whether or not to take Part D coverage or to remain on their employer's group health plan, and that can impact the lifetime determination of how much that costs. So it's important for that factor. Now, under the Inflation Reduction Act, there were a lot of changes made to Part D coverage itself. Significant changes that make overall the out-of-pocket maximums much lower under Part D coverage and covers things like vaccines and insulin quite differently than it used to in the past. And there are other significant changes to the way that Part D covers particular drugs. A list of 10 drugs, for example, those are negotiable with Medicare and the federal government. So a lot of changes, sweeping changes made to Part D coverage. So how is that going to impact employer-sponsored group health plans and the credible coverage status? That remains to be seen, but what this is saying is that they can continue to use the simplified determination, but really plans should continue to consult with either an actuary or should rely on the carrier's determination of whether or not the coverage is still in fact credible or non-credible. If it is, they can tell their employees it's credible. If it's not, they need to tell them that it's non-credible. So they need to think through this. Employers will need to think through this coming up when they go to renew their plans and these changes start to take effect for 2025, 2026 and beyond. So that's something that we're going to have to pay a lot more attention to and not just assume that most coverage is credible any longer. Let me know if you have any questions. Thanks so much for watching.